Hello everyone, I am Dr. Gaurav Bhandari, nephrologist and transplant physician. Any patient who has diabetes in the family, there are always 30% risk that the patient will develop kidney disease. That is the truth, that is the statistics. 1 in 3 people have diabetes and 1 in 10 people have kidney disease. That is how common the kidney disease and diabetes are. So then these diabetes patients are always at higher risk for developing kidney disease compared to normal population who doesn't have diabetes. So any patient of diabetes in the family, you should always screen whether the patient has kidney disease or not. So every yearly or every 6 monthly, you should do some blood test for the kidneys, some urine test for the kidneys, so that you catch the disease at early stage. So why this diabetic nephropathy question has come? Because the incidence is so common, the incidence is so high that the patient should be aware of this. So diabetic nephropathy is basically kidney disease secondary to diabetes. And diabetes is a multi-system disease. It just doesn't affect the kidneys, but it affects from head to toe all the organs it can affect. So kidney disease is diabetic nephropathy is basically kidney disease that is developed secondary to diabetes, in which there are various protein loss. There is low GFR, which means there is rise in creatinine. There are other symptoms as well. So the gist should be every diabetic patient in the family should be screened for kidney disease annually or 6 monthly, however the patient can. As I said, diabetes itself is a multi-systemic disease. From head to toe, it can affect everything. Secondly, it also causes other disease. Like as I said, it causes it can cause heart attacks. So this indirectly, this heart attack can affect the kidneys. It causes kidney stones. It causes neuropathy. It causes liver disease. It can cause everything. So all these systems, when affected, it can indirectly cause a kidney damage itself. And secondly, diabetes per se can cause kidney disease. So there are like this diabetes is the biggest villain, and there are some small villains as well with the diabetes. The commonest symptom which I've seen is in the later stage. So the body is so beautiful. In the early stages of the kidney disease, the patient doesn't have symptoms. So that's why we cannot pick up the disease in the early stage unless we do tests where we pick up the disease. There is proteinuria or there is kidney dysfunction, there is rising creatinine, but the patient doesn't have symptoms. These are the early stages where something can be done and we can reverse the kidney disease as well. But in the later stages, when the symptoms start developing, the options with the patient and the options with the doctor actually goes down. So the symptoms are like swelling in the legs. The patient gets breathlessness. The patient will say, I have froth in the urine. Whenever I pass urine, there is froth remaining. Even after flushing, the froth is remaining. There are some tingling sensation in the toes, in the feet, in the hands, which is known as neuropathy. So diabetic nephropathy comes with diabetic neuropathy, diabetic retinopathy, where the patient has some floaters in the eyes. The patient has some black spots while seeing anything. So definitely the patient has multisystemic disease ranging from the kidney disease symptoms like edema feet, which is swelling in the feet, breathlessness, from neuropathy symptoms like tingling sensation, from retinopathy symptoms like the floaters, the black spots while watching. So there are various symptoms along with diabetic nephropathy. Prevention is better than cure. So any diabetes patient, annual screening should be done with a blood test and urine test. So in order to detect diabetic kidney disease, the blood test should have some kidney function tests like creatinine value, sodium value, potassium value. These things will help to detect the kidney disease. Secondly, the earliest symptom of the earliest lab abnormality in diabetic nephropathy is urine abnormality, where we will see the loss of protein into the urine, some changes into the urine. Sometimes diabetic nephropathy patients can also have UTI and other symptoms. So you'll see pus cells. So urine test along with blood creatinine test, along with urine albumin creatinine ratio, which is a protein quantification, how much protein is lost. So these are the three tests which will help us to diagnose the diabetic nephropathy in the early stage. It is a multisystemic disease. So in brain, it can cause you stroke. In the eyes, it causes retinopathy, which can cause your loss of vision as well. Then it can cause various ulcers in the heart. It can cause heart attacks. In the liver, it can cause fatty liver, causing ultimately chronic liver disease. It can cause various infections. It can cause neuropathy, ulcers. We have seen various amputations which are happening because of the neuropathy, where the patient doesn't get any sensation. Some trivial trauma, small trauma happen on the legs, then it gets infected, it gets wound, the wound doesn't heal, ultimately causing the bone destruction, and ultimately we have to do amputation as well. So definitely diabetes is a very, very very severe disease. You should take it very seriously, even though if you don't have symptoms, but you should control it. If it is not controlled, it can cause n number of damage which you cannot imagine. So I always tell my patients to come with me, take dialysis rounds, see my patients, you'll get to know how serious diabetes is. The science has evolved so much after 2017-16. There are various drugs which have come to decrease the disease progression, kidney disease progression. So definitely in the early stage, I myself don't do dialysis, just any patient who come with raised creatinine. We always have to treat the patient and not the lab report. So even if the creatinine is abnormal, we try to control the disease. We cannot cure it, but definitely we try to control. So we'll give various symptomatic treatment, we'll give treatment to delay the disease more progression. So definitely there is medical therapy, there is conservative therapy, which is lifestyle changes, exercise, walking, no addictions and all sorts of stuff. The drug therapy, pharmacological therapy has various drug therapies which are there to control the diabetes, to control the disease progression. And ultimately, even after all these things, if the kidney has progressed to a stage where nothing can be done, then definitely dialysis is the option. The prevention should be done. So any diabetes patient has high risk of kidney disease. So we should detect the kidney disease at earlier stage so that we can prevent it. So what are the things to be done in diabetes patient? One thing, strict control of diabetes is very important, because diabetes, if it is controlled, it won't damage the other organs as well. So diabetes has to be controlled. Secondly, you should avoid extra stresses on the kidney, because diabetes per se causes stress on the kidneys. If you put more extra stressors, so diabetes and the stressors will cause kidney damage further. So stresses in the form of painkillers. So you should avoid taking NSAIDs or other painkillers which can damage the kidney. Secondly, urinary infection, urinary stones, obesity, which is associated with diabetes. So all these things are to be controlled so that the kidney disease doesn't progress further. Third, some dietary changes where the patient has to avoid junk, patient has to decrease the salt intake, patient has to avoid all the addictions. So all sorts of stuff is to be done so that the patient doesn't develop kidney disease, or if it is developed, we can reverse it or try to control it. Then exercise, regular exercise is very essential for the kidneys and for the heart and for the control of blood pressure. Third, fourthly, the blood pressure. If we say that if the diabetes patient develop blood pressure, then sometimes it is the involvement of the kidneys. So definitely blood pressure control is needed. So as a whole, holistic approach is needed to prevent diabetic kidney disease, where it consists of pharmacological therapy, the conservative therapy, which are lifestyle changes, and definitely some yoga and other stuff as well.